Hi, this is Mike Thompson with the National Alliance of Healthcare Purchaser Coalitions, and I'm here today with Bert Wachtelhausen from WellSpark. And Bert, I wanted to start off by exploring your way of getting beyond the silos and fragmented system we've used historically in health management and really kind of looking at it with more of a total person perspective. Could you talk about that a little bit?
Yeah, Mike. First of all, thanks for having me on. It's a real pleasure to be showcasing what we're doing at WellSpark. And you're right. We share your point of view that the current system is fragmented. First of all, WellSpark focuses on uh, people who have chronic disease and also people who are showing markers and trying to prevent chronic disease. And our approach is really to use a health coaching model, and we also put a proprietary behavioral diagnostic tool in the hands of our coaches, call it the Intel Inside. And really what we're trying to do is unlock what's going on in that person's world. We call it a biopsychosocial approach, really trying to understand, for example, if someone is gaining weight or not exercising or living a poor lifestyle, what is underneath that? And really, what is a barrier, a psychosocial barrier to someone not living a healthy lifestyle, or in the case of managing a chronic disease, what's standing in the way of that? And oftentimes it's deep seated, or it's something in a person's world that is impacting their ability to get and stay healthy. It could be that in their world, they are a caregiver and they take care of others before themselves. So our coaches are really trying to work with participants and use this proprietary tool set and take the approach that it's often not just one thing that's going on. There's oftentimes things that could be environmental or not just physical health that's going on, but behavioral health as well. So what we're trying to do is unlock what that is with our coaching model, and then help pull whatever it is that we find, pull it through and get that person help, guide them to the resources that they need, and stay with them every step of the way. So it's unlocking what's going on, biopsychosocial, but then pulling it through and getting that person the resources that they need to overcome whatever that barrier is.
And Bert, I know when we've talked, you've said that what we need to do to support these people as we unlock these issues is actually offer kind of an ecosystem of support for them. And if you do that, you actually will realize returns, because if you get to the underlying issue, you will actually help them self-manage their primary disease burden.
Yes, Mike, it goes beyond just figuring out what it is. And in today's fragmented system, that person is often left to figure it out for themselves, right? They may come to the realization that they need psych help or social work help, and the resources that they have are in the current employee benefits suite. They have employee assistance programs where they have to pick up the phone and call. And we find that no one calls, and the benefits don't talk to each other. Even the resources within a company, they don't talk to each other. Some are purchased in HR and some are purchased in benefits. So what we're trying to do is to bring these benefits together and provide within the WellSpark ecosystem, we say, access to talk therapy as an example, access to social work resources, access to nurses, all on our team. So it's, people are presenting with multidimensional issues, and we're trying to bring together multi-dimensional solutions against that.
That makes a lot of sense, Bert. And uh, what we have seen now in this COVID-19 environment is people are actually confronted with a lot more of these extraneous issues than they have, historically under normal circumstances. And I think this new normal could be with us for quite a while. And you talked about this issue of disease distress. It's a term I hadn't heard of before, but it's more than having kind of a comorbid mental illness. It actually gets in the way of people's self-efficacy, especially if they have a complex chronic condition.
Yes. So back to our approach here, just for 1 second, our nurses and coaches are using a tool set that does unlock what might be going in a person's world. And there's 17 tools in the tool set, and one of them is specifically engineered to probe for this chronic disease distress. Now, chronic disease distress is different from depression. It is just the overwhelming feeling of having to manage your chronic disease day in and day out. We hear from our participants that when people are self-managing a chronic disease, it's like having another full-time job. You have your full-time job and then you're managing yourself, and oftentimes you're managing others in your family, et cetera, et cetera. So our nurses and coaches are really locked in on focusing on disease distress and helping people with this overwhelming feeling. So if you think about that in the COVID world, people are having to socially distance. They're struggling perhaps to get healthy food on the table. They're out of their normal routines. And that can really throw your regimen out of whack. And if you're trying to self-manage your disease, then now you're having to go above and beyond to make sure that you're staying on a good path. And that causes stress. And what we're seeing and what our studies show is that if chronic disease distress goes up, then as an example, in the case of someone with diabetes, their hemoglobin A1C goes up. And that's bad. That's really bad. That's when things start to go sideways and people start to, need a doctor, may end up in the hospital. So we're really locked in on helping people manage chronic disease distress, keeping them on a good path. And when we're working with participants, we want to lower A1C because, we're always looking for medical cost savings. And our studies show, and national studies show, that if you can lower hemoglobin A1C, there's real money there. So if you go all the way back, we're focused on helping people manage a chronic disease, using the tool set, unlocking disease distress, helping people lower A1C, helping save money. But we're doing it with this ecosystem of support. So coming back to where we started, it's unlocking what that is, biopsychosocial, and then pulling through that participant to get access to the resources that are right within the WellSpark team.
So Bert, this sounds like it would have been relevant in any period, but it's particularly relevant in this period where we need to really go the extra mile to manage the risk prospectively, right? I'm fond of saying that where there is disparate risk, we should have disparate focus on mitigating those risks, and you're taking that people first approach that helps people get control of their own risks. And frankly, that protects them not just from their own disease, but more broadly in this environment. So thank you again, Bert, for participating in this conversation. Really fascinating, and really look forward to working with you over the coming years.
Thanks, Mike. Great to be here.